Good afternoon.
Good afternoon, Dr. Song. How are you?
Hi, how's it going? Thanks for the opportunity to come and speak with you all.
Yeah, thanks for attending. It's great to have you. It's really a pleasure to speak with you today. So, hello everyone. Thanks for joining. Thank you for showing up for our second episode of TEDx Today. Today we're joined by Dr. Song. So, let's jump right into it. Do you think you could introduce yourself, tell us a little bit about you?
Yeah, no worries. So my name is Dr. David Song. I'm actually a physician here in New York City, and I've been actively taking care of patients during these unprecedented times with the COVID pandemic. And what I've learned a lot from my experience. I've been very grateful for the experience, but we've also seen opportunities of where we can do better. And as a result of that, we formed a organization called ACTaskforce between myself, colleagues, who are also not in the medical field, but who are also like entrepreneurs, pharmacists, to kind of help during these times to see how we can make a difference.
Yeah, I think that's really great. So, I know you work in New York, and I think for a lot of us, COVID-19 has kind of resulted in the halt to our everyday lives, like
Yeah,
whether it be school or work. We've kind of just gone behind doors and stayed there, but I know that's not the case for you.
yeah.
So, how has COVID-19 affected your professional life?
It's just there's a lot of unknown. I think that's a difficulty everybody's been trying to deal with. It's a new disease. There's a lot of unknown variables that come with it. In terms of trying to slow down as much as possible in New York City and other hotspots, I think it's a little bit more difficult just given how connected people here are in New York City. But we've definitely, tried to make the best of it, help where we can help, and do our best. And if there are opportunities to help others, I think that's what we've tried to seek out and actively expand our reach to help those in need during these difficult times for people.
Right. I know New York was one of the hot spots with some of the highest number of
Correct. Yeah.
cases and deaths in the country.
Yeah.
So, working there, and I understand you work with COVID-19 patients as well.
Correct. Yes.
How did that change your mindset, I guess?
I think uh, it's just, we go into the profession wanting to help people. So that one of the most difficult things we've encountered is then sometimes when people come in, they're just very sick. We don't really have the best options to help them with. And unfortunately, there's not much we can do in certain situations. But, you know, I always believe there's a positive and a negative. And in looking at this unprecedented time, what we can learn is to be more caring and empathetic for everybody's situation, trying to be open minded and to learn as much as we can so that we can become better, especially when people are saying there's potentially a second surge coming, unfortunately. Hopefully, we can take
Right.
some learning points that we've taken from these past couple of months, be better, so if anything does happen again, we can provide the best care possible.
Right.
Yeah.
And in what capacity do you work with people who are, directly affected by COVID-19?
So during the pandemic, most hospitals go under a state called surge. And what usually means that is that everybody is mobilized to take care of COVID patients, just regardless of what your previous responsibility is. So, for example, I'm currently in training for cardiology, so all of our rotations were suspended in order to just care for COVID patients. And especially in our profession, we also have critical care training. So we were utilizing a critical care setting for the sickest of the COVID patients who are on life support for breathing or other complications. So that was our capacity and directly taking care of COVID patients.
Right. So it's very much all hands on board right now. Would you say it's
Exactly.
kind of died down at this point, or is it still very much, very
I think it has in terms of how many critical care patients in the hospital are currently under COVID or, complications of COVID. But I think we can't really rely on that as an accurate predictor of where we are in terms of this pandemic and the virulence of the disease because in my personal opinion, people may not agree with this, but when people come to the hospital, we've already failed in a sense of preventing them from getting this disease. We're now dealing with the end stage complications of a new unprecedented disease that we don't have a good treatment option for. So our goal as responsible citizens should be to prevent people from coming to the hospital by preventing the spread of the disease, and that's where the first step should be.
I
So
agree.
that's where we saw this kind of disconnect because one, we were blindsided by how aggressive this disease was, but as we're learning more and more about it, we see where we can improve. And one of the major aspects that me and my colleagues saw that we can improve on is definitely prevention. Because once you get a very serious complication with COVID and you end up in the hospital, our options are very limited and it can be very, you can end up with an outcome that's not desirable. And sometimes the very young, the very old, they're all very susceptible to these complications. So people should be aware of that.
I understand. Yeah, I agree that our nation and many of us have been more reactionary, I think, than working towards
Correct.
preventative measures.
Yeah.
And so I agree with what you're saying. And when in treatment in the hospital, would you say you're treating most of the symptoms rather than the actual virus? Is that kind of the direction you've gone in?
So the thing about viruses is that it's not like a bacteria where like a bacteria can cause infection and we have antibiotics to kill the bacteria. And most times for viral infections, it's to try to decrease I'm talking about viruses in general, not just specifically COVID, but for viruses in general, you try to decrease the amount of the viral load in the patient to avoid disease in the first place or to prevent the disease from happening with vaccines. My specialty is not in infectious disease, but those are the general concepts and theories we have to combat a viral infection. So when people have very severe complications from a viral infection, our options, one, are not very optimal, and two, especially with this novel virus, with coronavirus, and the fact that it's so aggressive, our options are even further limited because we don't have FDA-approved treatments at this point that are
Right.
proven to work effectively all the time, 100% of the time, which is why prevention is so important, especially now when people think that we're on a downslope and people become more relaxed as the country continues to open up. I feel like this is even more important now to be more vigilant to make sure that there is no resurgence of this disease. But unfortunately, we're kind of seeing the consequences of a lax attitude. I can give specific examples. I don't have the specific data, but the data from like coming out of Alabama, they had a very lax quarantine policy. They did not quarantine starting in May, and they're having difficulties in terms of providing critical care services because their hospital system is becoming strained and they're having a surge of cases. Now we're unfortunately seeing Florida as a potential hotspot for coronavirus because they are reopening maybe a little bit more aggressively than other states, and they're seeing more and more daily cases every day, and now the governor is saying maybe that wasn't the right thing to do. And it's not a matter of the right thing to do and the wrong thing to do, but the problem now is that there's a lot of unknowns. We don't know how to reopen safely. There's still a lot of unanswered questions. But we should focus on what we do know. And what we do know is that by preventing spread with protective measures like face masks, social distancing, and appropriate hygiene, those are things that have shown to decrease the spread of the disease. So we should focus on what we do know and implementing it as effectively as possible to make sure there's not a resurgence of this disease.
Right, definitely. And I know your thoughts on prevention, I believe these culminated in the creation of your organization,
Correct.
ACTaskforce, right?
That is
So
correct,
do you think you
yes.
could tell us a little bit how you went from an idea to putting this idea into action and co-founding your organization?
So we, based on our, intimate experience in caring for these patients, we definitely, like I said, want to do better all the time. And we saw that the need that we could really do better in prevention. And we came up with the idea of trying to provide protective gear to frontline workers and also high-risk communities during these unprecedented times. I am I am, with all ideas, it's hard to make it happen by yourself. So I've been very
Definitely.
fortunate in having great friends and colleagues, specifically Mahir Katuli. He's an entrepreneur and also a very close friend. He specializes in e-commerce, and he was able to kind of help us, form this task force and form this idea, make this idea a reality. And we've been very successful in trying to provide and source masks for people who need donations. And it's been a great experience so far, and we're happy to work with you all to hopefully expand our scope to help others in need. So we're very thankful for that.
Thank you. We're thankful to your organization as well. To people watching who don't know, we are very proud partners of ACTaskforce, and
Thank you.
we're both currently trying to get the word out more, to get more people to this cause, which is such a great cause. And what you guys are doing is just really phenomenal, because in such a short time putting together an organization, I know you guys probably had to hit the ground running.
Yeah.
A lot of other organizations have a lot more time. I know we did. We started last summer, and already, like, getting everything together, there's so many moving parts that you don't account for in the creation of an organization.
Yeah.
So what you're doing is really impressive.
Thank you so much.
Yeah. Do you think you could describe specifically, what your organization does, how you help out in the community, your mission? Yeah.
Sure, definitely. One of the things that, we've noticed during these times in trying to research and implement our own organization to help during these times, we've also noticed, there's, because of these difficult times, there are opportunities that some people see to help, but there are also, unfortunately, opportunities that some people see as a way of making a quick profit and benefiting from the situation. So some things that I personally notice and others I personally notice is one of the main things we've noticed is a resellers market popping up, or to kind of source PPE and like masks and other protective equipment. Primarily, they'll try to really undersell try to provide a very low price, or they'll also shoot up the price once they corner the market. And usually they try to move large amounts of uncertified, unvetted products that may or may not do what they say. So we saw this as a particular problem because if people are, first of all, people are having difficulty in knowing exactly where to go for masks, especially in the community, and also for frontline workers not directly involved in healthcare, such as, like firefighters, grocery workers. We don't think of them as frontline workers, but they definitely are frontline workers because they are vital to keeping cities and our, neighborhoods afloat, despite not working with patients directly. So for them, it was very difficult for them to go to a reliable source to get protective gear consistently. So one of our missions was one to fill that niche and provide certified, FDA certified, and also vetted quality products from a trusted source with a factory in China that we can work with and provide protective gear consistently, particularly surgical masks is KN95 masks, which is what we focus on. Because like I said, we know that what we do know about this virus is that it's spread through respiratory droplets, and by wearing masks in particular, you can definitely curb the spread of the disease. So that's one of our goals. The other goal is to really destroy this reseller market, because we don't feel that benefiting off others in this situation by providing a uncertified and subpar product is ethical or moral to do. So one of our goals is to provide a certified product consistently at market or below market price to companies that can pay for it, okay? But we also use whatever we get purchased from to provide 100% donations to organizations that cannot afford it. So to start off our organization, we as a group took money out of our own pockets. We took about $35,000 of our own money to really source a reliable product, and we just gave it out as donations. So far we provided about maybe tens and thousands, maybe about $60,000 in 60,000 max in donations to
Wow.
hospitals around New York City, the DC metro area. There was also a significant outbreak at a particular nursing home in Toronto, which we provided protective masks for the staff and the residents. And we also worked with Philadelphia centers, specifically Temple Medical Center, in order to provide KN95 masks as donations as well. But one of the things that we noticed is that, we can only take so much of our own money to continue doing this. We're not, Bill Gates. We don't have limited amount of income to dispose. That's why another mission is to really establish these supply chains with these organizations that can afford it, to not only provide a certified product, but from whatever they pay us, we use those 100% to provide donations to like homeless shelters, hospitals that are having a tough financial time during this unprecedented time, nursing homes and other organizations that may not necessarily have the finances to support protective equipment at this time. So those are essentially the core goals that we really want to focus on as an organization.
Right, and I think that's so key. I know that getting masks was really a hard problem early on just because supply and demand was so different. And I can definitely see how some people would be overlooked. As you said, some frontline workers aren't really identified as such. And so I think what your organization is doing is really important in that aspect. And also, I know you guys haven't been an organization for that long. I believe you're going to be 3 months on July 2nd. So
that is correct.
Happy early 3 months.
Thank you so much.
I think, that's so commendable that you've done this in such a short amount of time. And so do you think you could go over some of, the accomplishments or milestones for your organization?
Yeah, I think a lot of the accomplishments, I do have to, give credit where credit is due, because like I said, this is definitely a team effort. And Mahir Katuli, he's the gentleman who's an entrepreneur drive behind our organization to provide guidance on how to accomplish the logistics. And through his help, he's able to help us, make this dream come true. And like you said, in this short time span, we've been able to provide in donations about 60,000 masks around the country and to the nursing home in Toronto, to high-risk areas, growing hotspots for COVID infection, to organizations that didn't necessarily have the financial capability to purchase protective gear for their staff and themselves. So that, I think, in itself is a major accomplishment that I thank Mahir for. And I also want to continue to do that because there's so many things that we can do to help, especially as the nation is starting to think, it's going away, the summer's coming, let's reopen the economy. I think it's more important than ever to make sure that there is a consistent supply of protective masks and other gear for high-risk people, high-risk communities, so that a second spread does not happen. And that's with your help. Hopefully we can focus on expanding our help to reach, to help out, and through hopefully volunteers to really make our mission known so that we can help whoever needs it.
I agree. Yeah, that's great. And I know that you're mostly based on the East Coast, but are you aiming to, expand nationwide as you go on and as this second wave you're talking about is probably coming?
We are primarily based on the East Coast. That's where most of us are, but we are actually a nationally based team. We have, people on our team from Texas, from California. I think we are definitely trying to expand as much as we can, but I think our key goal right now is to make sure that the hot spots are taken care of, like Philadelphia, like Florida, and also New York City, right. DC metro area. So that's what we're focusing on. But like I said, with growth also comes logistical problems. I'm sure you guys have dealt with that before. So those are the things that we are still trying to work. So we don't want to run before we walk. I think what we've done so far has been amazing, but we're also trying to figure out the details in terms of trying to establish a consistent volunteer based to help increase our outreach. And hopefully with our partnership, we can definitely do that. And I think volunteer outreach, especially with a youth population, is very important, because as we've seen with everything going on, a youth movement in trying to establish a goal is very important and is the primary drive to move us forward, to move our country forward. And I think that's very important to take heed of.
Yeah, I think during this time, I mean, a lot of people have called it many different things, unprecedented times, like times of uncertainty. And so
Correct.
I think there's been a lot of loss of hope during this time for a lot of people, but there's also been such like a growth in youth involvement, people taking action, such as yourself and our
Yeah.
organization as well. People like trying to make a real difference. And I think that's really something to take heart in, especially as things may get worse, but people are really putting in their part.
Correct.
And
Yeah.
I know you were talking about a second wave, so do you think you could maybe go over the importance of PPE masks, especially as people, start getting more lax and maybe shrug off the mask?
Yeah. I think, the main thing we should just do is just follow what the CDC is recommending. And I think as the summer approaches, as people are, worried about going back to their favorite restaurant or getting that haircut that they've been so desperately wanting, I think these things kind of fall by the wayside. But the CDC recommendations are pretty clear that if you can, in a public space, wear a face covering, that would be ideal. If you don't have access to a surgical mask, a KN95 mask, or some type of protective mask, they would definitely recommend wearing a cloth covering in order to prevent the respiratory spread of the virus. And they've also clearly said that even if you are asymptomatic, that does not mean you are not a potential carrier, and that because you just don't have symptoms does not mean you cannot spread the disease to other people. So I think based on those things recommended by the CDC, we know how crucial face coverings are during these times. And as we slowly begin to reopen, not everybody has access to face masks. We know that. But that's why, hopefully, through organizations like us, we can provide that service and provide face masks through donations or at low cost, so that everybody can wear face masks, protect themselves, and more importantly, protect others once they're starting to go back to their daily routine and their daily lives. And we want to reopen as much as possible and reopen as much as anyone, but we also want to do that as safely as possible, because we don't want to be blindsided like we were a couple of months ago, because at the end of the day, we just want everybody to be safe. We want everybody to be healthy, and we also want everybody to do so, but also, make sure that everybody is protected. And that's, I think, the key thing to keep in mind.
Right. I think a lot of people, it's more of a question of getting educated yourself on how you can protect yourself as well as protect
Correct.
others. I think with the nation reopening, a lot of people are getting ready to go back into the swing of things, which is great, but I think a lot of people are also underestimating how hard this could hit us back.
Correct.
And
Yeah.
so
Definitely.
with the
Definitely.
nation reopening, what direction do you think you see our nation going with this? I know so far a lot of the measures that have been taken have been more reactionary than preventative. So what direction do you think this could go?
I think, like I said before, one of the main issues that we've dealt during this pandemic is just mainly the unknown. And
Right.
because it is such an aggressive virus and there's so many unknowns, it's complicated the situation very much for everybody. But I think the things that we can focus on that we do know is that this is a virus. And ultimately, if we are able to develop a vaccine that is proven to work, that would be the ideal situation. Testing is also very important, but testing without knowing what to do after the test, without having a good solution of whether you test positive, negative, what to do after that, is not the solution. So hopefully, as we learn more each day, we come up with, what to do in this situation, a vaccine, hopefully, and hopefully by continuing to really emphasize the importance of protecting yourself with either a mask, a facial covering, social distancing, proper hygiene, and just be smart about slowly, going back to your daily routine. I think those things will go a long way.
Okay, and how specifically would you say that people can help? I know that a lot of people have the passion to help, but I
Yeah.
think a lot of people don't know what they can do specifically.
I think, that's one of the reasons we wanted to really go on this platform because we know during these times people are quarantined. They see a lot of, there's a lot of energy to want to help, but because of these special times, not like you said, everybody is able to help. So that's why we want to, also kind of plug our website because it's called ACTaskforce.com, where we have opportunities for volunteers to sign up, and they can also reach out to me directly at my email at ddsong01@gmail.com. We're always looking for volunteers. Like I said, I think establishing a consistent volunteer base is very crucial for any organization to expand their reach to help others. And for what we're doing, having youthful volunteers energized about making change would be a powerful driving force to make a positive impact. And we would be more than happy to, for anybody to come and help us out because we, as much as anybody, want to make a difference, do the right thing, and make sure everybody's safe.
I think that is such a key thought during this time, the will to make a difference. I think that's what's really driving our country forward and, helping us make a real change.
Yeah,
And
definitely.
so if you don't mind, I think there's some questions that people who are viewing have said, so maybe we'll go over a couple of these.
Sure.
Let's see. Okay, so how do you think your job in hospitals are going to change permanently due to this virus?
I think this pandemic has definitely shed light on a lot of things that can improve. In my specific field, uh, I've been reading that there are theoretical changes that they're considering about using more telemedicine in order to not only actively take care of patients, but also to take care of patients in an outpatient setting. So one specific example I can give you that I read about is that in Europe, they're considering about when people come into an emergency room, they'll be actually going to a separate building from the hospital. They'll have a kind of like a webcam type telemedicine setup, and the physicians in the actual hospital will triage the patient to see how sick the patient is. If this patient really needs urgent care, then they'll transport patient from the secondary telemedicine building to the actual hospital for further care and management. I think those are just things that, kind of you can understand where we're trying to go with things to make sure that not only do we protect the medical and healthcare staff, but also the patient themselves. But I think with this pandemic, it's definitely been very eye-opening, and these changes, I'm not sure what the specific changes are going to be, but changes are definitely going to be in order. So,
Yeah, this is definitely a time where a lot of changes are being implemented just because this is such new territory for everyone.
correct, yeah.
Okay. Let's see, another question. When did you know you wanted to go into medicine?
Uh, Back in high school, actually, it was actually after an anatomy class, and then I thought about what else I wanted to do, and I didn't really want like a like a 9 to 5 job where everything was the same every day. I wanted to be challenged, and
Yeah.
ultimately, I wanted to, help people. I just felt that, like, with the science of, dissecting the frog at that time, unfortunately, and then like also, being able to help people and do something different every day. This was just like the perfect match for me. So,
And I think that's so inspiring. I think especially now people are seeing the real effects that a virus can have on a nation. So I think a lot of people will be going towards the medical field or other fields that help, in preventing the spread.
and definitely there is a need. I don't know if you guys heard stories, but like during this pandemic, there was such a need for medical staff that, there was in New York and all over the world, actually, there was a need for physicians to come take care of these patients. And the governor of New York put out a call to retired physicians, to come back and take care of patients. They also mobilize fourth-year medical students, advance their graduation. This wasn't just specific to New York. This was all over the world in hotspots like Italy, Spain. So this definitely demonstrated our vulnerabilities as a healthcare system, what our needs
Right.
are, and definitely anybody who wants to join the healthcare field, please, we do need your help.
Definitely. And we'll go for two more questions. Let's see. How will we give masks and proper health care to people who are in poverty?
So that's one of the things we really try to focus on is trying to source masks for donations. We're actually in talks with one of the largest Catholic churches here in New York City as they work with a very large homeless population to try to source protective masks for them. So, like I said, our goal is to provide donations of masks to not only frontline workers, but also very high risk communities. This would include homeless populations, the elderly, just very, communities normally that would not have the opportunity to finance their own protective equipment when needed. So those are things that we are definitely trying to work on, but I think by establishing a consistent volunteer base, we can definitely expand our reach to provide those masks and to find the need for masks within these communities. And that's why your all's help would be paramount to us.
Yeah, we look forward to continue to working with you guys in order to spread the news about your organization, as well as many others who can really make a difference in this
Yeah.
time. So, final question. What are your predictions as to when the curve will flatten out in the US?
I think it's really difficult to say because it's just so many unknowns. And what I say
Right.
today will probably be outdated, if not tomorrow, if not the next hour, will definitely be outdated by tomorrow. So it's really hard to say, but like I said, during these times where there's a lot of unknowns, we just really need to focus on what is known and to do that as well as possible. And what we do know is that protective masks work. They prevent the spread of infection, and we need more protective masks, not only for frontline workers, high risk communities, but to the community at large. So that's one thing we should focus on. And two, we should focus on hygiene, washing your hands. Number three, we should focus on keeping your distance, social distancing protocols. And the last thing is that as you're moving towards, uh, you know, going back to your daily routines, just be safe, keep your family safe. Know that when you're not doing these measures, not only are you putting yourself at risk, but you're putting your loved ones at risk and you're also putting the public at risk. So just please be a responsible citizen and do what's right, not only for yourself, but for others during these times.
Yeah, so I think it's quite an uphill battle we have going on right now, but I think with individuals such as yourself and people who are, committed to volunteering and organizations like yours, that we can really level this playing field and hopefully, get on top of this virus.
Correct.
So,
Yeah, I completely agree.
so thank you so much for joining me on live today. This is a lot of fun. I really enjoyed talking to you.
No, thank you for the invitation. And, like I said, thank you all for the partnership. We're very excited about working with you all. And, the thing is, if you want to volunteer, just please feel free to reach out to us.
We definitely will. Thank you so much for being here with me, and thank you everyone else for attending our live. We hope to see you next time.
Thank you so much.
So,
Take care.
you as well.